We're back to residence rights. According to the CNA exam, you will have at least 10 questions on resident rights. So let's talk about the type of questions you can expect to see. You may have a question regarding a resident refusing a bath. You want to make sure that you demonstrate respect by being okay with that and notifying the nurse. You want to allow the resident to choose their clothing as long as the weather permits. Always give the resident choice when answering your test questions. You want to take residents' complaints about staff seriously, and if it presents itself in a test question, you want to report it to your nurse. It's a privacy violation to leave your resident exposed. So if you have a test question and the resident is exposed, of course you want to pull the privacy curtain or provide privacy. As a CNA, it's not in your scope to answer questions about medication. Any questions about medication should be directed to the nurse. If the nurse is yelling or another healthcare provider is yelling or acting inappropriately within the healthcare environment, you have a duty to report this type of behavior. You want to protect the residents' rights. You want to avoid any HIPAA violations. You cannot post videos or photos of the residents on social media. Let's talk about exam tips for residents' rights. Correct answers always provide privacy, maintain the resident's dignity, encourage the resident's independence. The correct answer keeps the residents safe. The correct answer protects confidentiality, and it allows the residents to have choice. Keep these things in mind when you're selecting your answer selections. It's never acceptable for CNAs to force care, argue with the resident, ignore a resident's complaint, or keep abuse secret. Healthcare providers have a duty to report allegations of abuse, whether it is confirmed or suspected. If you're unsure about your answer selection, choose the answer that is safe and respectful. Let's talk about CNA responsibilities. CNAs must